Okay, everybody, welcome. I'm going to get started with our webinar now. So I am Michael Balkenhol. Welcome to Libraries Build Healthy Communities Going Virtual with Brooklyn Public Library. I'm joined with some colleagues that I will introduce later on, but I have a few housekeeping things to go through. This webinar is an instance of the NNLM class Activate, Collaborate, and Educate, Health Outreach and Programming in Your Community. Attendees today are able to claim 1 continuing education credit from the Medical Library Association. If you're working on your CHIS or your Consumer Health Information Specialization, you can earn 1 credit for today. There will be an evaluation survey when you exit the webinar that will pop up where you can follow instructions about claiming credit. All attendees are muted upon entry for the webinar, so please find the chat. And you can answer any questions or comments that you have into the chat. Captioning is also available for this webinar. To view live captioning, follow the captioning link in the chat. During the next hour, I will definitely be asking some questions and asking for participation. So please do use the chat box to share your thoughts and ideas. A full resource list with links to everything we are covering and today's slides are available on the class page, which is the link that says nnlm.gov/ZBS. And you can find the handout and the slides there if you'd like to follow along or to reference it later on. So before we get too far into today's webinar, please do use the chat to introduce yourself. And while we do that, I want to say our agenda for today, I'm going to talk about some health programming resources from the NNLM and other partners. We're going to talk with our friends at Brooklyn Public Library about their virtual programming. And then one of their partners is going to share about health programming community partnership as well. And hopefully we'll have some time for Q&A at the end. So before we dive in case we have audience members who aren't yet familiar with the NNLM, please let me give a quick overview of who we are and what we do. The network of the National Library of Medicine, or the NNLM, serves as an outreach and engagement arm for the National Library of Medicine, which is part of the National Institute of Health, or NIH. The NNLM provides trainings, funding opportunities, and more to a wide variety of member organizations to help support our mission of advancing the progress of medicine and improving public health. Institutional membership is free of charge, and joining the network is easy. For more information about the NNLM, you can visit nnlm.gov or connect with your regional medical library at nnlm.gov/regions. So we are here today to talk about virtual programming mostly because of COVID-19. So I would like to share 2 resources related to the coronavirus or COVID-19. The National Library of Medicine and the NNLM are directing public health inquiries to the CDC, the Centers for Disease Control. And for the latest research information, you can go to nih.gov/coronavirus. Many attendees today might be educators or library staff who are possibly still working remotely or doing some virtual programming. So I welcome you all as we talk a little bit about virtual programming today. So a question for the chat. When you think of health programming in libraries, whether you're in a public library or a different kind of library, what comes to mind? What programs are popular at your library? And or have you gone virtual? So I'm going to kind of take a peek into the chat. Thanks, everyone, for introducing yourselves. It looks like we have folks from New Jersey and Texas, North Carolina, and Massachusetts, Idaho, Atlanta, hey, folks from St. Louis, Kentucky, Arizona, Orlando, awesome. So Zumba has been very popular, yeah, so movement and physical activity stuff for sure. Yeah, virtual programs on healthy eating have been very popular, that's great. Local walking tours. Walking book clubs, cycling events, yeah. So all kinds of things have moved to virtual environments. So the NNLM has a a national resource guide for public libraries with links to health information resources, including multicultural and multilingual resources, substance misuse, and mental health resources. Additionally, there's links to health programming, collections, and other resources listed here. So a bunch of the things that I'm going to share are all now found at this one place on the NNLM site. That's in the resource guide. Please do check it out. It is new and updated. On the Getting Started tab of the Public Libraries Resource Guide are some links to webinars about virtual programming that the NNLM has supported. And additionally, in an effort to support libraries who want to remain engaged with their communities through the COVID-19 pandemic, NNLM is offering a virtual health programming series. We hope that this will be a great resource for libraries who are interested in promoting and doing some virtual health programming but might not have the capacity to do so. And there is all kinds of events that are regularly being added that can be featured right alongside any virtual events that your public library offers. So a quick note about NNLM and summer reading. For the last 2 summers, we've offered some health programming ideas related specifically to the collaborative summer library program's themes for summer reading. So I know summer reading looks very different, I'm sure, for most libraries this summer, but we did have some programs, my favorite of which was a dental health story time that was inspired by the Tooth Fairy and other tooth traditions around the world. And for 2021, soon we'll have some animal themed programs, mostly around citizen science and virtual engagement too, that'll be posted on our website to help support you through the summer months. So if you are a citizen science or you have hosted citizen science projects, drop a message in the chat with what you have done. I'm always curious to see. And if you're not super familiar, SciStarter is a citizen science partner for us. They are an online community dedicated to improving citizen science experience for project managers and participants. There are over 3,000 projects and events that are searchable by location, scientific topic, and age level. And by joining SciStarter, members can track their contributions and make valuable feedback. SciStarter supports events and projects. This summer, we partnered with libraries across the U.S. to provide virtual events for summer reading around citizen science. One of them featured a program on light pollution that anyone with a smartphone can participate in. And we featured that with a small library just north of Pittsburgh, close to where the University of Pittsburgh is based, where I work. And if you are interested in learning more about virtual citizen science, please do check out one of the links in the resource guide, which is to scistarter.org/NLM. There's a lot of cool opportunities to engage in a different way. The National Library of Medicine produces traveling exhibits, which are made available free of charge to public, university, and medical libraries, as well as cultural centers across the country. Though there is a shipping fee, always talk to your NLM Regional Medical Library to inquire about funding sources to help you pay for those costs and possibly for some programming to be related to it. The traveling exhibition is comprised of banners. There are usually about 6 of them, which contain information about their particular topic. And there's also a supplement of information available online for each of the topics. The permanent online exhibition is enhanced by educational and career resources for educators and students as well. So if you have a big space in your library where you would be able to host an exhibition, please do check it out. The NNLM Reading Club is a selection of ready-to-use book titles along with free and downloadable materials designed to help libraries support the health information needs of their communities. The selections are reflective of national health observances like mental health awareness, LGBTQ health, nutrition, racism and health, and many others. Here is just a shot of the mental health series of books that we have offered, including RX, which is a graphic novel by Rachel Lindsay. And there's all different kinds of titles to look through. Each month, titles are added along with downloadable resources, print and social media, marketing materials as well. For quite some time, we offered book club kits, meaning we were sending these out to libraries. And because of COVID-19, that is on hold indefinitely. But all of the materials are online if you run a book club and want to do a health topic. So some resources outside of the NNLM. Let's Move In Libraries is a great resource for movement and physical activity programming happening in libraries. They have a newsletter that you can subscribe to, which always features up-to-date things. I just read about a library in Maine who decided to do cooking classes because they are a CSA pickup site, a community-supported agriculture pickup site. So there's always really inventive ideas that people working in public libraries share with Let's Move. One of the fun features of their website, perhaps if you're in a small library and you're worried about liability and things like that, before doing walking programming or anything like that, they have examples of those forms along with how to do a lot of different programs. It's definitely worth checking out. Programming Librarian is a resource of the ALA, and it features resources, ideas, and professional development opportunities. There are, if you actually host programs and want to share your successes, you're welcome to do that, or take a look at the health and wellness programs that have been featured and completed in other libraries across the states. So I wanted to talk a little bit about scaling up or scaling down health programming. Today we feature our friends from Brooklyn Public Library, but perhaps you're in a smaller library and you're just thinking of how to get started with health programming. I always say connect with the programs that you already have going. So if Storytime is your big program, check out a resource like Jaybrary. When I worked as a children's librarian, it was one of my favorite sites for learning new finger plays or movement routines, tricks and songs. There's all kinds of really great information on here, including some health and fitness related YouTube playlists with sections like body part songs, finger plays, tickles and emotions, feeling story time, and movement and dancing story times. And the website also has great bilingual and multilingual story times as well. So please do check them out. So national preparedness is always kind of comes up in times of crisis for the NNLM. And I just wanted to point to ready.gov, which was launched in February 2003. It's a national public service campaign designed to educate and empower American people to prepare for, respond to, and mitigate emergencies. That can include natural and man-made disasters. And the goal of the campaign is to promote preparedness through public involvement. So it is a really good place to find information on preparing for emergencies, including evacuation plans and making kits. And I've seen and I've heard of many libraries doing programming events and offering information about how to make kits for people's houses. So if you're interested in going that route with your health programming, please check it out. And ready.gov has information in 13 languages. It's a pretty great resource if you're thinking of doing any emergency preparedness programming. So back to the chat, I'm curious of your favorite programming resources. It can be for health programming or maybe other types of programming that you do. I'm always looking to find new resources to share with folks that I talk about. So so yeah, if there's any programming resources that you would like to share, please do drop it in the chat. Yeah, Jaybrary has been a favorite of mine, is what someone commented. I love it. Instructables, Make Magazine. Yeah, Make Magazine. I forgot about it. It's a really good one. Yeah, Let's Move In Libraries. I think they're a great resource too, especially the newsletter. It's really nice to see what folks are doing and what trends are popping up. So feel free to continue to use the chat. I'm going to move on to introducing our friends at Brooklyn Public Library. NNLM MAR, the Middle Atlantic region where I work, has worked with Brooklyn Public Libraries on a series of projects and programs over the last several years. And in the spring of 2020, when the U.S. was hit with COVID-19, many public libraries moved their in-person programming to virtual environments. And today we have some folks from Brooklyn Public Library and one of their partners to talk about how they did it and to share their wisdom. So first I'm going to introduce Sarah Montrechard Ramon Cabrera. And Sarah was hired by Brooklyn Public Library in November 2019 as the Community Health Coordinator for Outreach and Services at Brooklyn Public Library to lead the work to engage community partners and develop health programming at the 59 branches of BPL. She holds a BA in International Relations and a Master of Public Health, or MPH, from Florida International University. And I will also introduce Molly Cass-Kaufman. She is a library science student who came to BPL in 2019 to coordinate the Libraries Build Healthy Communities Conference. She currently works to connect BPL staff and community health partners, and she coordinates and facilitates virtual health programs for the Libraries Healthy Communities Initiative, which is in part sponsored by the NNLM. And with that, I'm going to pass it off to Molly and Sarah, and thank you again for being here today.
Everyone, this is Sarah Montrechard Ramon Cabrera from the Brooklyn Public Library, and I just wanted to start our portion of the presentation to kind of give you some background on how our Healthy Communities Initiative came about, which actually, led to us doing virtual programming. So back in 2019, we launched a Healthy Communities Initiative with the main goal to improve health outcomes for library patrons and leverage library resources to impact health equity, which in turn would allow us to support programs, partnerships, and staff training around health across our branches for Brooklyn Public Library, with three key goals in mind: to increase the health literacy of Brooklynites, address social determinants of health, and inspire a culture of health among our patrons and our staff. Next. Okay, and with the support of NNLM funding for our initiative, it's allowed us to host a 2-day Healthy Community Staff Conference, which actually happened literally a month before I was hired. And having that wonderful Healthy Community Staff Conference provided us with a platform where we were able to host 2 fellowships for our library school students, where they would be able to learn more about health in the library setting. And also in the winter of 2019, as a product of that Healthy Communities Conference, we were able to convene a coalition of partners from across Brooklyn that currently serve as a network that we use to coordinate in specific neighborhoods and branch libraries, and that's also where we've been able to leverage a lot of our partnerships going into the transition for virtual programming. Next. Okay, so what is the Healthy Communities Initiative? Our Healthy Communities Initiative focuses on the health and well-being of all Brooklynites by providing programs, services, and resource collections to the public. Our initiative focuses on 5 key areas, which are mental health, maternal health, healthcare access and literacy, nutrition, and positive aging. Our initiative is also focused on providing public health education, and that's done through community partnerships and, of course, interactive virtual programming. Brooklyn Public Library has and continues to be committed to advancing health equity and improving community well-being. Next.
Hi, everybody. My name is Molly Cass-Kaufman. I'm the Healthy Communities Associate at Brooklyn Public Library. Thanks, everybody, for having me. Thanks, Michael. So as you might be able to tell from a little bit of the timeline that Sarah provided, we were really doing a lot of work to do programs in person leading into the spring. So after March, we had to cancel a lot of programs that we planned in person, and we made a quick and unfamiliar shift towards virtual outreach. So it was a really steep learning curve, but ultimately it became clear, as you might be able to tell from the word we keep using in this presentation, the foundation of our relationships with our community partners was really important going before the pandemic and now. So, I'm sorry. We work really hard to build strong relationships with these partners. We find folks whose work aligns with or can strengthen our programming and service goals. So I think that this is important in general for public health librarianship, not just for planning programs. But what that means more practically for us when we started coordinating this program, these programs, is that we were relying heavily on 4 kinds of contacts: community-based organizations, public health institutions, our library colleagues, and freelance educators and artists. So those are people who have done generally paid programs for us in the past. I want to talk specifically about the benefit of collaborating with other library staff and other librarians within my institution and outside of it. I work with other people who have done virtual programming to talk about what works and what hasn't worked, and to develop ideas. So that's also important for us because there are 2 of us in a really big system. So we build capacity, we delegate work, and we can work in conjunction with other colleagues to really find what is effective for our patrons. So next slide, please. Sarah, you're up.
Okay, yep. Okay, so adapting in-person curriculum to virtual programs, which is always a huge challenge. And so one of the key things that you want to think about is coordinating an initial meeting with your presenter or the organization that's going to be providing the program for you, because what content looks like in person versus what it looks like virtually could be very, very different, especially for the second point when it comes in terms of a format. You want to make sure that in that initial meeting that you discuss what that format's going to look like, and that it's going to provide adequate time where you're not going to only have, content that's discussed, but also to allow for attendees to ask questions. It's completely different when there are people who may or may not have access to a camera for you to kind of see and read the audience as to if they're understanding the content that's being presented during the program, versus some people who only have access to call in if Zoom is a platform that's used by phone. So it's important to make sure that whatever content and whatever format you come up with the host, that it makes sense. What Molly and I have found that's been kind of the standard that we kind of present to our organizations, and we kind of just leave it up to them if they say that works for the content that they want to present or not, is usually a basic format, which consists of 45 minutes of content and then 15 minutes at the end. The only scenario that I can think of where that format has not worked is if we've done any type of mental health resiliency trainings, which usually require 90 minutes to 2 hours, because that curriculum is usually adapted according to city and state guidelines. So those particular organizations have to cover certain material. But other than that, most of the programs that we've been able to coordinate with our community partners have been no more than an hour, and that hour is broken down, as I just explained, which is 45 minutes of content, and then at least 15 minutes for Q&A from the attendees. Also, it's important to make sure that the presenter has enough lead time. One of the biggest things that we encountered is that a lot of organizations, this is their first go-around going virtual. It was very surprising for us to kind of find out that not only were we in the same boat, but then having organizations that are used to providing a certain amount of content within a given type of setting, and now having to adapt everything for a virtual format. So you want to be cognizant, like for instance, we're now in November. So November is American Diabetes Month. So if I wanted an organization or one of our community partners to present a topic on diabetes, you want to make sure you're asking at least 3 weeks, if not a month in advance, just to make sure that they, A, not only have the staff available, but B, you also decide on what type of format you're going to use. If it's going to be your particular virtual account, or if it's going to be their account. You also have to think about, promotion. There are a lot of things to consider. And then, of course, one of the things that Molly and I found to be super effective, given that a lot of organizations may have not presented their programming in a virtual format before, we had to make sure we scheduled test runs just to make sure that on actual program day that everyone is able to connect. You know, we live in a world of technology, which can be a blessing and a curse. And, you know, if the weather's bad, you may not be able to connect, you know. So just kind of making sure that you cross your T's and dot your I's, that you schedule that test run so that it's established on the organization side. Who's going to be a host? Is there going to be a co-host? Do they have someone who's an IT person? If their slides kind of like stick, you know, so just making sure that all of these logistics are discussed, you know, for an initial meeting. And then, of course, you can schedule a follow-up meeting if need be to kind of hash out anything else, whether that's, you know, who's going to be responsible for promoting the program. You know, some organizations who are also grant funded may or may not require certain demographics and certain metrics that they have to take away from the program. That could be anything from like, what are the age, you know, what are the ages or the age range of the attendees, you know, or what is their zip code, you know, or what is their gender, what is their race. So those are certain things that is extremely important to identify in that initial meeting, because with us being the library, we don't really ask our patrons that type of information, but there are ways to kind of get around that where the organization that's hosting the program can actually have all of that information preset in their registration link. Then that way the only thing that you're doing is promoting the program on your end. And when you send that particular program link to your patrons, they will go directly to the organization's website, and then that organization gives them that option whether they want to answer that information or not. So that's just, you know, kind of a recommendation on that portion, but definitely making sure that at the very minimum that you follow these 4 kind of organizational and planning steps to make sure that your virtual program is very successful. Okay, and then some of the highlights and challenges, of course, of going virtual. So 2 of the major highlights, there's so many, but 2 that really Molly and I have experienced, you're able to reach a larger number of patrons, you know, from your network and beyond. Molly and I found, especially with the movement programs, you know, bless their hearts. Some of our attendees attended as far as like England, some from Australia, you have some from the East Coast or West Coast, and we've also had like fellow librarians supporting us from all over the country that just want to sit in and see what a virtual program looks like and, you know, from a library setting. So you definitely have a greater reach because, like I said, technology is a blessing and a curse. Almost everyone has either access to a computer or at least a phone at the bare minimum. And Molly will go into it later in the presentation, but certain formats work well with the phone, whereas other formats work a lot better with you having access to a computer, iPad, or like, you know, some other type of electronic. And then, of course, you're able to provide a larger number of programs and cover a lot more topics because, of course, space is not an issue. Molly and I are based at our central flagship branch, which is Central Library here in Brooklyn, New York. And so we had an extensive process prior to virtual programming where you would need to schedule, I would say, probably a month or 2 if you wanted to use what we would call our like meeting areas, if you wanted to host a program, or if one of our community partners, for instance, our community partner on this call, New York Presbyterian Brooklyn Methodist, we're doing a Stop the Bleed type of in-person event prior to COVID, which would provide like basic CPR, right? And so you have to account for what that physical space is going to look like if you're trying to accommodate 25 people. Well, you take that out of the equation when you have a Zoom account or WebEx, and there's not like a set limit. You can have as many as 100 people attending or even more. The only time that we ever were asked to limit certain numbers of attendees for our programs would be like for those mental health resilience workshops, where a lot of the mental health workers would ask that we only limit it to about 30, just for chance that there's someone that may be going through a crisis or may want like one-on-one attention. That, you know, for Zoom, I can't speak for other virtual formats, but Zoom does allow you to have a breakout session. So there are a lot of benefits also to using the virtual format, which Molly will go into. Now, some of the challenges that we faced. like I said, technology can be a blessing and a curse, but we also have to be mindful that some of our more underserved patrons may not have access to technology. So that's a real thing. And of course, with not all branches being open right now, if any at all, to allow patrons to come in and be able to use the computer, that's something that's a barrier, especially if that particular virtual format requires that the patron have access to a computer. So speaking for Molly and I for Brooklyn Public Library, we're always mindful to make sure that we use Zoom, because Zoom does allow a person to just call in. If they have access, depending on what type of phone they have, they may or may not be able to see the slides. If there's an actual slides that or a presentation that accompanies the program, but at the bare minimum, they can listen to it. So they're still engaging. They don't necessarily have to see everything that's presented, but we always give the option at the end, especially with the permission of our community partners, that if they would like to share, the information that's provided during the program, then with our system that we have where patrons register for an event, then we have that option to email everyone after the program so that they have that information. But at the bare minimum, you want to make sure you establish, are there going to be any barriers when you actually schedule your program? And then the second part, which Molly and I really encountered a lot. So our particular department for community health falls within the Outreach Services Department here at Brooklyn Public Library, and we share the account with quite a few other departments. So what we would always find helpful is you want to give your community partner options for dates, but you also want to be mindful of what your previous attendance may have looked like, and you also want to look and see what the availability is like. So for instance, Molly and I have found that a portion, if not a good majority of our programs, are always scheduled at either 11 in the morning or 1 p.m. in the afternoon. So we usually would give our hosts that option, and we don't schedule any type of programs on Monday, only because that's Molly's administrative day and my administrative day as well. So you want to be mindful of that. Am I going to have any conflicts with any other departments if you have like a Zoom account that's a business account? So there are a lot of logistics that you just want to make sure that you don't have a problem, because there is a such thing as being Zoom bombed. It does exist, where if someone schedules a program at the same time, someone may be dropped from the program. So you try to minimize, things happen, but you try to minimize as many, possibilities for that as you can. And then, of course, the final point being connection issues. Technology is not glitch-free. I've unfortunately had to, lesson learned, where I was kicked out of a program, and, it happened all but once. But what I found out is that once you make someone, whether I would make Molly, if we were co-facilitating a program together, or I would make the program host for the organization that's hosting the program, the co-host, and something would happen on my end with my technology, because, sometimes your Wi-Fi is a little spotty, and you may drop off, but the program still continues. So through trial and error, Molly and I have learned how to either make, one another a co-host, or to actually make the person that's presenting the host, to kind of prevent any glitches. But like I said, technology is not glitch-free and things happen, but through trial and error, you kind of, you get through it.
As you can tell, we've had a lot of really successful programs, and we have also had more than a few unsuccessful programs. As Sarah mentioned, it has been a lot of trial and error, but I wanted to highlight a few of the different kinds of programs we've done and why they've worked. So Tai Chi for fall prevention was or it might have even been one of the first series of movement programs that we offered virtually. And as I can tell from the chat, all of us who have been doing virtual programming, we know how popular movement programs are. So we worked with our wonderful partner, Gia Ramsey. She is a nurse, and she works for a hospital in Brooklyn, and she had offered a series of one-off programs a few one-off programs for us about injury prevention. And then she talked to her, and she told us about her training as an instructor in this specific curriculum for Tai Chi for arthritis and fall prevention. So our target audience was older adults, and we had about a dozen patrons who signed up for the 8-week series. Well, Lino is joining us to talk about her series, but I wanted to just mention that working with a hospital and working with Lauren shows what we can do, what caliber of programming is possible when you are joined by health experts and doctors. Yoga for All was a program that we offered for all ages, and it was a good example of a program we did with an instructor that we met through a colleague who had previously worked with Serafina. It's great to be able to offer a class for free that would otherwise be paid for, and so we're grateful for the support of NNLM and NIH. And then lastly, our Health and Wellness for Job Seekers series provided a really wide array of information and strategies for folks looking for work during the pandemic. So it was a really targeted set of presentations and workshops, and like Sarah mentioned, we were able to have a broader geographic reach, not just because we were offering things virtually, but because we were collaborating with other libraries. We worked with our colleagues at the Queens Public Library, and there were 4 departments from both libraries involved, and we had 70 patrons who learned about all the virtual services and different health, wellness, and job skills. So next slide. Okay, so yeah, there are a lot of tips for using platforms and managing registration. As Sarah mentioned, using Zoom provides a call-in number, which is really great in terms of access, even though we are working against all of these barriers to access that do impact our reach. Ultimately, what we found is the most important thing is to have a single link for registration and to keep things streamlined. So we don't post our information publicly. That's why we require registration. There's a much higher likelihood that people with nefarious purposes will join your program if you post it publicly. I have seen it happen that people join library programs to yell obscene things, and if not share their screens, it's not good. So check with your institutions and check with colleagues about what's worked for them. We have specific guidelines based on what we've learned. So it's a learn as you go situation, but that's okay. I'm still learning a lot. And I've found above all that usually if I'm not struggling with the technology, someone else is. So we have found what works for us best at this moment, but we're still trying to think through some of the broader issues of how people are able to access our virtual services.
Okay, so building relationships with community partners, which of course is very important. And so we leverage and we continue to leverage the community partnerships that existed for us prior to COVID from previous programming, and also a lot of our partnerships, of course, that came out of that Healthy Communities Conference that we had back in October. But with COVID, we've also been able to foster a lot of new relationships with our organizations, near branches, by coordinating with the branch staff who have community buy-in. And that's something that's really important. Eva reminded me in the chat. Eva is our Director for Outreach Services here in Brooklyn at our Brooklyn Public Library. And we have something called Healthy Champions here. And basically, those are a lot, they're not necessarily outreach librarians, but they're library staff who are incredibly passionate about anything that's health and wellness related. And so one of the initiatives that came out of our Healthy Community Staff Conference that we had was the formation of this team. And so these health champions are librarians that may or may not be interested or may not have already established relationships with community organizations that are near them. So they're really giving like a hyper-local approach to just kind of put it into perspective as far as leveraging health and wellness resources that are within a 2-mile radius of their particular branches. So even though Molly and I kind of found it a little bit challenging to get in touch with some of the staff because some people were working from home and some people were not scheduled to work from home. So we really couldn't tell who was working and who was just kind of like on administrative leave until we started rolling out different phases for our staff to return to work. But what Molly and I found is that there were a lot of staff who were like, hey, I had this dancer-size class that, that our patrons were interested in doing. Can we still do that? And so, with the support of NNLM, what we're finding is that a lot of people are now interested, not just people, but our library staff, our colleagues at the other branches that we serve are interested in being a part of the virtual health programming, now that they kind of see how easy it is to kind of reach out to, the instructor, in this case, dancer-size. And then, of course, Molly and I take care of the administrative portion, which is making sure that we have like a performers agreement. So that's something that you can check with your organization of what that would look like. But it's basically an agreement that just says, what the service is that's going to be provided, what time it's going to be provided, how it's going to be provided, all the expectations that you want. If you want the program host to show up 15 minutes prior, you just make sure all of that is in the agreement. And I saw a question in the chat where someone was asking if all the programs were free. Some of the programs with our community organizations, like our hospitals, were completely free. And then some of our movement programs, like the yoga and the Zumba, came with a cost. So that's something that you want to establish, especially if you don't have the budget to pay outright for those services. Just realize that there are a lot of resources that don't require a fee. Another thing that we also found incredibly useful was joining community advisory boards. So, our community partner, Lauren Avellino from New York Presbyterian Brooklyn Methodist is going to speak shortly. But, Brooklyn Public Library has always had a good relationship with them. And we were able to kind of not just join, but be an active participant in the community advisory boards that they have. And so if, for instance, a community advisory board was meeting regularly in person prior to COVID once a month, then maybe they extended it to being quarterly. So if that's something that kind of exists in your system, you can always check and see like what community advisory boards you're already a part of. If you have a governmental affairs department, most likely they would be able to tell you if the library is involved in any community advisory boards, but you can also look locally. A lot of branches fall within certain districts that have their community advisory boards, and that's just a good basis to network and meet other community-based organizations. And also, of course, attending community town hall meetings to meet other organizations and promote the resources and services of your library. I found that Molly and I were always invited to a lot of town hall meetings, especially given that a lot of town halls wanted to find out how they could work with the library and get information out to not just our patrons, but to the community of Brooklyn in general, especially since Brooklyn was hit hard. Everyone knows that New York City took the hardest hit in the start of this pandemic. And so everyone, when I say everyone, I mean like government, city, libraries, every different branch of government coming together to just kind of figure out how to respond to this pandemic. And so, having town halls, whether it's through the comptroller's office or a town hall with, our fellow community partner, which would be Queens Library, our fellow library, and just kind of working in conjunction versus working in a silos, effort to kind of just make sure we get this information out to patrons. So, those are 4 different ways that we've kind of build and continue to build on our community partnerships to be able to provide resources and information to our patrons, given this pandemic. And so this is just a snapshot. We actually had our marketing department, which we love our marketing department. They're so gracious. They actually built out a Healthy Community series for us because, as I said, the community health department is still fairly new, and, you know, our marketing department took a huge hit trying to make sure that they got all of the signage and, you know, down to every update that our Governor Cuomo here would provide them, to making sure that we gave our patrons up-to-date information on any closures and, you know, any phases that we would go into. So, of course, being able to provide public-facing services. And so our marketing department created a event series page, which you see here, and the link is down below. And basically what this is like our event calendar. So all of the events that we have scheduled with any of our community partners, for instance, we had one this morning, Streetwise Pedestrian Safety for Older Adults, that we did in conjunction with the New York City Department of Transportation. And then we have 2 virtual health fair Test and Trace Tuesdays, which is basically like a COVID-19 communications forum where any patrons that may have questions regarding any resources that are available for COVID or where they can go and get tested. Because, of course, with COVID being such an issue here, especially in New York, the library was awarded a $200,000 grant with the New York City Department of Health and the New York City Health and Hospitals, which came up with this Test and Trace Core. And so the library is a Tier 2 partner. We've got a team of over 20 people that are, you know, a mixture of librarians as well as part-time health ambassadors. And basically what they've been doing is providing tablings. They've been providing virtual presentations on what we're offering for Test and Trace. So whether that's where a patron or attendee can get tested, or if they want more information on what kind of tests are available, anything related to COVID, our Test and Trace team has been incredibly diligent. We have over 20 zip codes here in Brooklyn that we've been able to kind of reach out to and just kind of make an impact as far as giving people information on how to reduce the spread of COVID, but also how to get tested, you know, if that's something that they're concerned about. So I would definitely say make sure that you just leverage those community partnerships. It's never too late or too early to start, you know, reaching out to some of your colleagues. You know, there are a lot of people that we see and pass every day that we have no idea, like, wow, you're really into this stuff. And so, you know, I would encourage you all to just kind of have those conversations with your colleagues. You know, they have like some of the best resources. But virtual health programming is definitely possible. You just have to make sure you have a plan. And with that being said, I'd like to introduce our community partner from New York Presbyterian Brooklyn Methodist Hospital, Ms. Lauren Avellino, who's the Manager of Community Affairs.
Sarah, thank you for having me. I was thrilled when the Brooklyn Public Library reached out to me to participate in this series. I've been at New York Presbyterian for about 2 years, and I've been at New York Presbyterian Brooklyn Methodist for about 13 years. So I'm responsible for community affairs in the Brooklyn location, and our service area is actually all of Brooklyn. So we are, it makes sense when we decided to partner with the library, and while we have partnered with the library, because we are both 2 large stakeholders within the Brooklyn community. Next slide, please. So you can see here, and I can describe it, it's a map of Brooklyn, and we are, while the library has many branches throughout the borough and the hospital has many off-site medical practices throughout the borough, our main headquarters for the library and the hospital are located just about a mile away from each other. So as I mentioned, it makes perfect sense for us to partner because we serve the same service area. Next slide. So, you know, a neighborhood is only as strong as its neighbors. As Sarah mentioned, the library sits on our community advisory board, and we have worked together with the library for a number of years to provide free community programming. We also, our borough president has this banner that's up at Borough Hall in Brooklyn, and it's all about how we're in this together and how Brooklyn is staying strong. So we're supporting each other, especially during the pandemic. Next slide, please. So here's an example of what partnership has looked like and the in-person programming has looked like in the past with the hospital and Brooklyn Public Library. You know, we've done events, we've partnered with the library to do things at the Central Library, at the New Lots Library branch in Brooklyn, at the Macon Library branch in Bed-Stuy, and also in Coney Island. And these date back like about 10 years. I've been at the hospital a long time, so a lot of these pictures were taken by me, and we've been happy to do these in-person events, and we would get large turnouts when we put them on. Next slide. Obviously, you know, things have changed with COVID-19, and we sort of had to make a shift. And so in terms of our engagement with the library around the Healthy Communities Initiative, we started to get on board with them back in October when Molly helped to coordinate the Libraries Build Healthy Communities Conference, and we were a part of that, that conference. And then that resulted in an in-person meeting convened by community organizations who work together in Brooklyn. And so we came to an in-person meeting for that in December. And then we wrote a letter of support actually for the grant that the library applied to from the National Libraries of Medicine to provide virtual community programming. And then this past summer, we finally launched that program together with the library. So next slide. As Sarah mentioned, you know, New York City was the epicenter of COVID-19. So while during the process of us sort of expanding and strengthening our partnership with the library, the pandemic was unfolding. And so, you know, here's a timeline. I think everybody is familiar with it, but basically, you know, I just wanted to illustrate that at the same time that we were sort of working on our plans for the rest of the year, COVID was unfolding before our very eyes. Next slide. So we had to make a shift to virtual, and we're very happy that we have the library as a partner. We have a number of organizations who sit on our community advisory board, the library being one of them, and we had been in close contact with all those organizations throughout the pandemic, just doing check-ins, seeing where everyone was and how they were doing. And the library was one of the very first partners to say they were ready to get back on board and start virtual community programming, and we were so happy to do that with them. So we jumped right in. You know, the hospitals made a transition to virtual, not just in community, but also with our medical care. You know, in a short 2-month span, we saw over 20,000 patients telephonically and through virtual health. And in the same time frame, we sort of put things on pause in terms of our community programs and moved over to the virtual programming format. And normally we coordinate about 300 events a year, but we're on track to do 200 this year because we've had to sort of make that shift. But they've been very meaningful, and we've been excited to do them, especially with the library. And I know that we are behind. We're running a little bit behind, so I'm going to try to breeze through here. I just wanted to talk about, you know, how much synergy there is between the library and the hospital. You know, the library's Healthy Community Initiative has some key tenets that they focus on, and the hospital every 3 years conducts a community health needs assessment to identify areas that we're going to work on in the community. And so you can see we're currently in a 3-year community service plan that we engage in once we conduct the community health needs assessment. And so some of the areas that we're focused on are preventing chronic disease, promoting healthy women, infants, and children, and also promoting well-being and access to mental health support. Next slide. So, you know, again, as Sarah mentioned, there's a lot of sort of overlap here, you know, mental health, maternal health, positive aging, all of this sort of, and also the focus on the social determinants of health. You know, all of that is overlap, and that's why we decided to hone in on one of these to start, and we chose maternal health to start. Next slide. So we just developed a program called Educational and Emotional Support for Expectant Parents, and it was a 4-part series where we engaged our internal hospital stakeholders who are experts on child care, and we developed a 4-part series with them. Next slide. So here are the screenshots. We made sure that we took a screenshot at each Zoom session so that we can sort of capture the collaboration that was involved with each of these. And we had a great time hosting these, and the library was a great partner. And I think that, you know, one of the things we're talking about is what makes a virtual program success. And, you know, a virtual space is definitely sort of a new foray for a lot of us, but relying on a community partner is a great way to ensure that together you can work towards the same goal and you can increase your audience base and reach out to more people, because each organization will probably have their own tools and audiences to reach out to. Next slide. So the program was super successful. Across 4 sessions, we engaged over 100 expectant parents. We had more than 16 clinicians, including lactation consultants, nurses, and physicians who participated offering the education, and more than 30 questions were answered in the chat box. Next slide. So what's on deck for our next few months? In September, we had done a men's health series. In October, we offered a breast cancer lecture, and we are preparing for pediatric and adult diabetes awareness lectures in November and December. And with that, I believe that's our last slide, so let's open it up for Q&A. Or I'll turn it over to Michael.
Look through questions and things that folks shared. A few things that anyone may have missed. Folks did share that there are some Facebook pages for library staff, including the Programming Librarian Interest Group, which I follow also, and the Libraries Are Champions of Healthy Communities too. It looks like many of our questions were answered throughout with by staff that are in on the webinar from Brooklyn, but if there's any outstanding questions, please feel free to drop them in the chat now. And again, a handout with the full contact info for all of us, and resource links is available on the website as well. So I don't see any questions coming through yet. There we go. Can you compare the different platforms? So I could just say I have some experience with WebEx and Zoom, and Facebook Live, and streaming to YouTube as well. And my personal experience is that Zoom has been overall the easiest to use, but I'm curious to hear what my colleagues on the call today have to say.
Yeah, I think for me too, Michael, I can agree that Zoom has been easier. We started hosting virtual programming via WebEx and just found it a little clunky and there were more barriers to access for folks to join in. So we found that Zoom has been our most successful platform in offering virtual programs.
And as Sarah mentioned too, there's a lot of ways to tinker around with the administrative rights so that you can have it completely locked down to Q&A where there's no chat, or if it's a smaller group that you are more comfortable with, opening it up a little bit more, letting folks use a chat that everyone can see. There's lots of options there. If there are any other questions, please do feel free to drop them in the chat. And again, our contact information is available. It looks like we're right here at 4 o'clock. So yeah, a question, can anyone share how they adapt programs for young children, considering many have been online or home all day? Brooklyn, have you done any programs specifically for youth?
You know, we have not actually done any programs specifically for youth, but one thing that I have been talking to colleagues about is kind of similar to what Michael was talking about at the beginning of the presentation. It people are interested in incorporating health and wellness themes into pre-existing programs, and that seems to be what will be most effective. And unfortunately, at this point in New York City at least, it means virtual. There were some outdoor programs over the summer, but we're approaching colder months now, and COVID numbers unfortunately are going up. So it takes a little bit of practice.
And, I can also offer from the hospital standpoint, we did provide a workshop, a sibling preparedness workshop for younger children, and we were very conscious of making sure the content was short and sweet, making sure that, especially through Zoom, that the parents who were joining with their children renamed their usernames so that the kids' names were shown on the screen. And we made sure to engage and to call on each child in the virtual presentation to keep them engaged. And, we did group activities like sing-alongs and swaddling your stuffed animal. And so that was all stuff that we had prepared the parents for ahead of time to know what to expect. So I think it's important to be really focused when you're doing things, especially for young children. So we found success in keeping it short and sweet, making sure we called on everyone and gave parents a heads up on how they can participate.
That's really great advice. I did share a link to the NNLM Public Libraries resource page, and it includes links to different webinars that we've held in the past. And a colleague of mine had a presenter do a virtual programs for preschoolers webinar, and the recording is available for that right now, and you're welcome to check it out at that link, in addition to tons of other resources. I don't see any other questions in the box. Again, a huge thank you to Molly and Sarah and Lauren for spending your time today. We do have one last question I see. What is a successful size limit for, say, kindergartners? And do you have 2 hosts or leaders, if anyone wants to answer that one?
Well, when we hosted a program for the sibling preparedness, I think we kept it to no more than 12 children in the group. I think that it was like 10, 12 is like the sweet spot. And there was one main presenter, but there were 2 other people from the hospital organization and also from the organization we worked with, who were sort of admin folks there to help with getting people engaged.
It sounds pretty similar to like an in-person kids program. 10 or 12 is like a sweet spot, and then it kind of starts to get more impersonal with large audiences.
Yeah.
All right. Well, with that, again, thank you, Molly, Sarah, and Lauren. Anyone attending the webinar is welcome to email any or all of us with any follow-up questions. And again, a lot of the resources we talked about through the webinar are available on our website, so on the nnlm.gov website. So thanks again so much for everyone for attending, and again, Molly, Sarah, and Lauren for all of your time and for sharing the awesome work that you're doing. Thank you.
Yeah, it's been a pleasure. Thank you for having us.
Awesome. It was really great. Thank you very much.
Everybody.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.